Living well with major depressive disorder. Hello, everyone. My name is Donna Edwards. I'm a certified addiction treatment counselor number 4. Despite the sometimes crippling symptoms, major depression is manageable and treatable with medication, therapy, or both. People can recover and lead happy, fulfilling lives. Major depressive disorder is a serious mental illness that affects how people feel, think, and go about their everyday tasks. The condition can also impact a person's sleep, habits, appetites, and ability to enjoy life. Major depressive disorder isn't something that eventually passes. While most people feel sad at times in their lives, major depression is when a person is in a depressed mood most of the day, nearly every day, or for at least 2 weeks. Some people feel depressed without knowing why. The onset can happen at any age, but it usually begins in adulthood. People may only have one depressive episode, but most have multiple episodes over time. While the exact causes of major depression is unknown, some risk factors include a family history of depression and significant life events such as trauma, times of high stress, job loss or relationship, or the death of a loved one. People with a serious medical illness such as heart disease, cancer, diabetes, or Parkinson's disease may be at an increased risk of developing major depression.
I can feel self-confident, self-esteem, but I'm still battling this sadness deep down inside. That's like a backpack that I carry with me at all times. I'm Mike Vini, and I'm living with major depressive disorder. It's not about thinking positive. It's not about snapping out of it. It's a condition. It's a condition you just live with. Sometimes in therapy, uncomfortable things come up and people are afraid of that. Those uncomfortable things are great teachers. So I don't even see it as therapy anymore. It's self-discovery. You are in charge of your treatment ultimately. It's not in someone else's hands. You are in charge. Peer support is so important. To be in a group with other people who are going through the same thing just makes it so much easier. When I'm having a bad day, I can give somebody a call. They might be going through it too, but it's just nice to have someone to connect with that gets it. I'm aggressive about my self-care. I have a self-care checklist for each morning that I have to do certain things just to be able to show up for the day and hope that my depression is not in the worst place. It's a process, not a destination. And I want people to know that you are not your diagnosis.
What are the types of major depression? There are several types of depressive disorders. Postpartum depression affects women after having a baby. It causes intense, long lasting feelings of anxiety, sadness, and fatigue, making it difficult for the mothers to care for themselves and or their babies, as well as handle daily responsibilities. Postpartum depression can start anywhere from weeks to months after childbirth. Psychotic depression is a form of depression with psychosis, such as delusions, false beliefs, and or hallucinations, which are hearing or seeing things that are not there. Seasonal affective disorder is triggered by changes in seasons. This form of depression usually occurs during the fall and winter months when there is less sunlight. Melancholic depression is a severe form of depression where people have a complete loss of pleasure in almost all activities. What are the signs and symptoms? Major depression symptoms vary from person to person. To receive a diagnosis of major depressive disorder, some of these signs and symptoms must be present for at least 2 weeks. Anyone who has questions should consult their doctor. Continued feelings of sadness, hopelessness, pessimism, emptiness, fatigue, lack of energy, insomnia, or other sleep issues such as waking up very early or sleeping too much, anxiety, irritability, restlessness, feeling worthless or guilty, lack of interest or joy in hobbies and activities, changes in appetite leading to weight loss or weight gain, moving, talking, or thinking more slowly, forgetfulness, trouble concentrating, thinking clearly, or making decisions, vague aches and pains such as headaches, joint pain, back pain, or digestive problems, and thoughts of death or suicide attempts. Learn about Dan's experience with major depression.
Nobody could do anything worse than what depression had done to me. When I turned about 40, I was the managing partner at my law firm. I was just sad all the time, but things started to go really off the rails when my sleep became fragmented. I just couldn't get enough sleep and was told at that time that I had major depression and that I needed to go on medication. People can't recover from depression by themselves. I mean, that's what's so wrong about stigma. At the end of my life, what's going to count is what I've done for other people. And for me, the biggest contribution I can make in that effort is to connect to other people with major depression and let them know they're not alone. You can be a professional person, you could be a working person, and you can live with depression.
Okay, so there's treatment options. They are major depression is treatable with medication therapy or both. Keep in mind, treatment plans are different for everyone depending on the type of depression and severity of the symptoms. Medication. There are many types of antidepressant medicines that treat major depression by improving the way a person's brain controls their mood or stress levels. These medications may take up to 4 weeks to take full effect. People may notice their sleep, appetite, or concentration issues improve before their mood lifts. Therapy, regularly talking to a trained therapist, such as a psychiatrist or psychologist, helps people identify the triggers that contribute to their depression, replace negative behaviors with positive ones, better cope with stress, set goals, and stick to their treatment plans. What can you do? Daily habits do make a difference. These healthy lifestyle habits, along with professional treatment, can help you manage the symptoms of major depression. Focus on self care. Control stress with activities such as meditation or Tai Chi. Eat healthy, exercise, and get enough sleep. Most adults need 7 to 9 hours of sleep per night. Avoid using alcohol and recreational drugs, which can worsen symptoms and make depression harder to treat. Set small, achievable goals. Set realistic goals to build confidence and motivation. A goal at the beginning of treatment may be to make your bed, have lunch with a friend, or take a walk. Build up bigger goals as you feel better. Know the warning signs. Recognize your depression triggers and talk to a doctor and or mental health professional if you notice unusual changes in how you feel, think, or act. If needed, your doctor can safely adjust your medication. Write down how you feel day to day, which are your moods, feelings, even how you reacted, to spot patterns and understand your depression triggers. Educate family and friends about major depression. They can help you notice warning signs that depression may be returning. Seek support. Whether you find encouragement from family members or a support group, maintaining relationships with others is important, especially in times of crisis or rough spells. Stick to the treatment plan, even if you feel better. Don't stop going to therapy or taking your medication. Abruptly stopping medication can cause withdrawal symptoms and return of depression. Work with a doctor to adjust your dose or medication if needed to continue a treatment plan.